You want me to keep my computer down or I'm okay?
It's fine.
Yeah.
So, hi everybody. I am Dr. Mahima Bakshi, a maternal child wellness coach, author, Birthing Naturally, a woman activist, and the youth ambassador from India for the International Youth Society. With so many celebrity couples going ahead and planning to have a baby through surrogacy, I decided to do a discussion on the latest in the surrogacy and ART laws in India. And I have with me a fantastic guest for today, Dr. Hrishikesh Pai, who is also the President elect 2022 for FOGSI and the Director of Bloom IVF. And he's also a renowned IVF expert and a senior gynecologist. Joining me right now from Mumbai, but Bloom IVF is across Mumbai, Delhi, Navi Mumbai, Mohali, Gurgaon. And I welcome you to the show, sir.
Thank you. Thank you.
So, keeping today's topic in mind, sir, since it's all about the new surrogacy and the ART laws in India, I believe something new also has been passed by the government. So, let's first discuss about the basic ART new laws. So, if we look at a lot of couples who plan to go for IVF or couples who are having problems with conceiving, what are the new laws in India as far as the ART is concerned?
So, Mahima, first of all, thanks for calling me and inviting me on this show. Like the IVF movement in India has been there for a long time. Say first baby was in the world was born in 1970, I forget,
Oh my God.
1978, Louis Brown, and then UK and then the first baby in India was born in 1984 in KM Hospital. I was one of the, means I was a junior that time. That was one of my seniors, Dr. Indira Indija, was instrumental. Of course, there's also some mild controversy on that. That the first baby, actual baby, was born in Calcutta, but it was not properly appreciated and documented. Now they have appreciated it, and so that's the first baby. But since then, since 1990, a lot of units started. I was one of them. So in the first phase of the IVF movement in India, about 7 8 units started doing IVF in India. I started also in Mumbai at that point in time. There was, I remember, a unit in a very famous unit in Kolkata, then in Jaipur, then in Delhi, then we had a unit in Chennai, we had a unit in Bangalore, and 3 4 units were there in Mumbai. One of them was my unit. So since then we are doing IVF, and somehow down the road, the Indian Council of Medical Research. You keep on seeing it on the net nowadays. The director keeps on coming and talking about to us about COVID infection. So the same ICMR, Indian Council of Medical Research, they started doing the ICMR guidelines, and many committees were made, and the guidelines came out. And I remember vividly in 2000, around 2003, 4, the guidelines came out where they talked about surrogacy, etc. And because they started talking about it, I remember we started doing the surrogacy as well. So that's how the surrogacy started, and the IVF movement picked up steam. And now, for from 10 units in 1990, we are at around 3,000 plus units in today in 2022. So nearly in 32 years, there is an exponential growth in the ERT units in the country.
Right.
And then the government, multiple government, they tabled, so they made two acts. One was the ERT bill, and the second was the surrogacy bill. And these acts were introduced in parliament. There was some back and forth, some things were changed by the government, and ultimately these two acts were passed last month on 21st and 25th. 21st of I think December they passed the ERT bill, and 25th of December they passed the surrogacy bill. And this yesterday, 25th, both of these were enacted, and they started. The beginning of the bill has been started since 2 days back. That is on 25th.
Okay. Which is quite recent.
Yeah. So now things are changed. So your viewers will need to know exactly what is it, what they can do, etc.
Yeah.
And I'll throw a light on it so that they have a clarity of it.
Yes. Yes. So many couples nowadays are actually opting for surrogacy as a method of having a baby. We have so many examples from Bollywood, and we've seen the recent case of Priyanka Chopra and Nick Jonas having a baby through surrogacy. And so, what is your take on it? And what is the new guideline? What is the new law when it comes to surrogacy in India?
So first of all, you must understand, all of your viewers, that many people confuse infertility with surrogacy. It's not so. So if you're an infertile couple, 90, let's say 70 to 80% of the time, you can achieve pregnancy with simple methods. You can just do planned relation. You can do weight loss, diet, exercise, timing of your ovulation, which is called timed intercourse, and all that will give you 80% will conceive. Some of them will need a laparoscopy. If you have endometriosis, PCOD, you will correct that. So
Hmm.
80% will conceive with all that. After
Hmm.
that, 20% need IVF. So
Hmm.
if we have got 100 patients that come to me for having kids, around 70-80% of them will become pregnant with routine. They don't even need IVF. After that, the remaining 20 patients will need IVF. Of that 20%, patient nearly 95% will just need IVF on their own self. So IVF is what? You take your eggs out, take your husband sperm, make the embryo baby outside the body, and put it back into your own womb. That's IVF.
Hmm.
So out of those 20 that need IVF, so 100 couples, 80 will become pregnant easily. Remaining 20 will need IVF. Of these 20, with 3 attempts of IVF, nearly 18, 19 of those couples will become pregnant. Only out of the 20, about 5% will need surrogacy, or let's say
Okay.
2%. So we are looking at a 0.4%. So in 1,000 patients who are infertile, maybe one or two will need surrogacy. So in
Right.
surrogacy, it's just like IVF. You take the egg out, take the sperm, make the embryo, but instead of putting it in your own womb, you put it in another womb. That's called surrogacy. So the
Right.
surrogacy need for our society is just about 1 in 1,000. Okay.
So, but
So
but what if somebody has not even tried for IVF and directly
right.
comes to
So
you and
that's
says
called
that we want to
surrogacy.
go?
So some of the people now they say, "Oh, my figure is not good."
Yeah,
Blah
yeah.
blah. What are the indications for surrogacy? So in our country, the biggest problem in our country is tuberculosis.
Hmm.
It hits the all organs, so it also hits the uterus and damages it permanently. So
Yeah.
even if you do IVF, make the embryo and put it in her own womb, she will not become pregnant. So
Right.
that for this kind of woman where the uterus is severely damaged, many of them they don't even get periods. So in that case, there's only three alternatives. One, she adopts a child, or she makes a baby, takes the egg out, takes the sperm, makes the baby. But instead of putting in a womb which is badly damaged, she can put it in a surrogate. Or third thing, she can do a womb transplant. So
Okay.
she can take a uterus from another donor and transplant it. So these are the three options she has got. Adoption, which is not very easy nowadays because there are not
Yeah,
many
yeah.
children for
Takes a
adoption. There's a
lot of
big
time.
waiting list. Second
Yeah.
is a surrogacy, and third is
Correct.
a also there are certain people who have an absent uterus.
Right.
So they are born with an absent uterus or a very small uterus, underdeveloped uterus. Those are called RKHS syndrome, and these people also they either adopt a child or they have a womb transplant or they need surrogacy. And
Hmm.
there are certain people who have medical problems. Suppose they have a very bad heart, they have a coarctation of aorta, which is narrowing of the aorta. If they have a
Hmm.
child, they will probably die. So these
Right.
patients, for medical indication, need surrogacy. So
Right.
these are all three good indications, but there's a one last teeny weeny indication. Okay, there's one more indication that you do IVF, you do repeated IVF cycles, embryos are good, you put them in the womb, but you still fail, or there are patients with recurrent miscarriages, five
Yeah.
miscarriages, seven. In those patients also you can do surrogacy. So these are the medical indications. But there is a lifestyle indication. Oh, I don't feel like having a kid. I
Yeah.
don't want to damage my figure.
Yeah.
And if a guy wants a baby, how can he have it? There's an unmarried guy. How can he have a child?
Yes.
So he has to borrow an egg from a donor, take his sperm, make the baby, and put it in someone else's womb. So
Yeah.
these two last indications, the lifestyle indication, and a guy wanting to have a baby,
Yeah.
or a gay couple have wanting to have a child,
Yeah.
they would need surrogacy.
Right.
Okay, also, but that, so now the new surrogacy bill, they
Yeah.
don't allow that. So in
So
our
so
country,
that's the biggest change, because earlier we've seen
yeah,
a
but
lot of
that's not. But
single
the
dads
problem
also
is
getting
that this is
surrogacy
the
done.
biggest problem with our country, because this segment is the smallest segment.
Yeah.
Because of these people who did this surrogacy for lifestyle purposes, it got repercussions, and we
Right.
had to come out with a strict law.
Right.
But what happened in the process? All those millions of people, our middle class people, our poor people who actually need surrogacy, they are the ones who get afflicted with tuberculosis. They are the
Yeah.
ones who get damaged. They are the ones who get divorced
Yeah.
because they can't bear a child.
Yes.
These are the
Yes.
people who needed the surrogacy.
Right.
And these are the people. So the government has brought in its wisdom, it has brought in a law which this, because surrogacy is nothing, not something you could go and have a nice cup of tea and say, okay, let's have a surrogacy. No, surrogacy
Yeah.
is the ultimate. And let me tell you, most women don't like to have someone else bear their child. Would you like to
Hmm.
have that? Someone else? The bearing of the child is an experience.
Yes.
Just
Yes.
like everything else in life, every woman wants to experience that.
Yes.
And
And
so
it's
they
about
are
giving the best environment to your child for those 9 months. You know that you are the one taking care of your baby, carrying the baby with you. So, of
yeah, so
course,
people don't like it. So very, very teeny weeny, maybe one in very infinitesimal people who want to not have the kid. They are not the exception. They are not the rule. They are the exception. Most of the people say, no, doctor, do whatever you can. I want to have the child. I've seen so many people with multiple IVF failures, 5 failures, 7 failures, 8 failures, multiple miscarriages. They want to have the child. That is the main indication of surrogacy,
yeah.
not the
Yeah.
lifestyle. So in our country, we have banned for lifestyle purpose. You can't. So in the new surrogacy bill, if you
Yeah.
want to do surrogacy, just like a transplant, you have to go to the committee. Committee will be formed. Magistrate has to first. The committee will accept whether you have the indication for surrogacy, which has to be
Right.
medical. Then the application will go to the magistrate. Magistrate will issue a certificate, and then you can go to a IVF center which has got a license to practice surrogacy, and then you can
Okay.
practice surrogacy. Again, the surrogate cannot be paid; it has to be
Yes.
voluntary.
Yes.
So it's called altruistic surrogacy. Once upon a time, the surrogacy was commercial. So if you go to United
Yeah.
States, in USA also there are 51 states. So there are certain states in United States where
Mm,
you can pay
mm,
and have a surrogacy. But many states in United States do not allow surrogacy. Also
mm.
within the United States, the state, because the state health is a state subject. So
Yeah.
I mean, I would not take the name, but many who
Yeah.
are doing it for lifestyle purpose, if they go to USA, they can pay for it and get it done, but not in India anymore. And
Right.
what happened is also because we didn't have any law. There was a lot of laxity on our part. People used
Yeah.
to do everything. Many
Yeah.
people did it for lifestyle. That's why we started getting a bad name. Our
Yeah,
international
because we
standard.
saw so many examples also amongst the celebrity couples. We saw so many couples at the age of 50s going for their surrogacy and having a baby at the age of 50. So
Yeah.
I think that age limit also wasn't there
Yeah,
earlier.
so we got a bad name, and so
Yeah,
in its wisdom, our government, our fathers in the parliament, in the lower house, in the upper house, they brought in the Surrogacy Act. But remember, it is only 1 in 1,000 infertile couples
yeah,
who need surrogacy indicated. Forget the lifestyle.
right.
I told you most people in will not go. Everyone wants to have the child themselves. Very few people are there who will say, "Oh, I don't want to spoil my
Yeah,
figure," etc.
yeah,
etc. No way.
yeah,
Everyone, all women want to enjoy the
yeah.
pleasures of bearing a child. That is what makes a woman dominant. Because a
Yes,
woman has two roles. What are you? You are what? You are a living example. You are a very enhanced woman, emancipated woman. You are educated, you are independent, you have your own income, you have your own decision making ability, and you also want to have a child. That is what makes woman a powerful. Men are
yes,
nothing in front of a woman. What is the difference? Why do women have power? Because they have the ability to bear not only do everything that a man does, but man can't bear a child. That
Yeah,
power which a
that
woman
makes it
has,
different.
that is a dominant. We men can't do it. That is the most dominant thing which a
Yeah,
woman has.
yes, yes,
Please understand it.
completely.
So remember, so now the ERT bill has been passed and the surrogacy bill has been passed. Surrogacy is more or less for very less amount of people, and there are a lot of restrictions. So I don't know how we'll implement it. We have to see how the government makes the rules. They are now the bill is passed. Now the rules will be made, and the
Yeah,
rules, if we can adhere to it, we will do it. If we can't, then we'll not do it. So if you look at me, for example, I
yeah,
will have a look at the rules, and if I feel that maybe yes, maybe I can do it, maybe see, the most important part of this bill is how much in our society, the Indian society, what is the level of altruism.
yeah,
So this is a very landmark bill because it will make us understand what is the altruism in our Indian society, which is the huge amount of altruism is there abroad. Western societies,
yeah,
they donate a lot of money to charity.
yeah,
Western societies will donate a lung also to another person without any money for
yes,
charity. That
yes.
is known as altruism. Doing something for another human being without any expectation or monetary gain. Can we Indians do it in our society? That is what I'm interested in looking. This is a very interesting next 12, 10 years and make us understand. And I'm sure that there are a lot of altruistic people in our country. You just so now till now the surrogacy was done for money. Now
Yes,
is the
yeah.
challenge. Can you, Mahima, do it for a friend without money?
That's
That is
that's
the challenge.
that's where it's going to become difficult to find surrogate mothers now
No.
because
Yes,
initially,
but it will
yeah,
become the change will occur. Now, what will
I
happen is
still wonder. Yes, I
but
still wonder how
let the
easy would
altruism.
it be.
So where is so you'll say where will the surrogate come from, sir? Who will do it?
Yeah,
People who have undergone the process of infertility, who know the pain of infertility, they have to volunteer to help their other colleagues. People who are infertile, who have done multiple IVF cycles, they have to volunteer to give their donate their eggs. That is what is done abroad. Lot of people do it for altruism,
but
and
sir,
that
in
is
India,
that
I
is the
wonder
most
whether the
evidence
in-laws.
based. That is,
Yeah, in India, I wonder whether the husband and the in-laws are going to allow the woman to do all this.
we don't care about husband and women. We have got people like Mahima, independent, enhanced, emancipated, understanding. We need people like you to do it. The society has to change.
Yeah,
Okay, now what is our request to the government is we are requested the government to have a look at it, that if suppose during the process of donating their eggs, or in the process of doing bearing the child, if the government in its wisdom says okay, your
mm,
manners are being lost, for 15 days you're undergoing the surgical procedure, for 9 months you're bearing the child, you may have to stay at home, you will lose that much of your income,
yeah,
you need to be given food
yeah,
and clothing, so that compensation, if at all the government will decide what can be the compensation which can be considered not as money, but
mm,
as just a mild kind of taking care of your daily needs. So, for
yeah,
example, to give a parallel example, in United Kingdom also, egg donors cannot be given money, but the government has said that 750 pounds can be given to them for their khana pina, process, travel, whatever, during that
yeah,
11 days when they take injection, they do
yeah,
follicle monitoring, they undergo surgical procedure. So the government of UK has fixed 750 pounds for their compensation, not for giving money because they are donating, but giving money because they have to travel to the doctor, they have to have food, blah, 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 all
yeah,
those things.
yeah.
Similarly, our country will have to fix an amount
Some amount.
which is
Yeah,
not money to pay donate, but it is money for compensating your your and the trouble that you undergo. So we
Yeah.
don't want to encourage people to donate for money.
Yeah.
We want to encourage people to donate for altruism. However, in the process, if there is some chai pani ka kharcha that can be
Yeah.
compensated, and that, if at all the government agrees, will be decided by the surrogacy board.
Okay.
National board will be formed.
Okay.
So
Okay.
in the next 3 months, and that board, in its wisdom, which will be made up of government officers, bureaucrats, lawyers, women's health groups, doctors, civil society, all of them will sit together
Hmm.
and answer this question. First and foremost, do we need to compensate some amount of the man-hours loss, the trouble that they undergo? And what is that compensation, which will not be considered as enticement, but
Right.
which will be considered as a mild compensation?
Right. So, sir, if we also talk about, there are so many. The community, LGBT community, is also now increasing in number, and if we look at a lot of people who are undergoing sex change operations as well, or there are so many transgenders who are out there, and if they decide to become parents and want to have a baby, so would surrogacy be allowed for them?
So, first of all, ERT, we won't talk about surrogacy. Surrogacy is 1 in 1,000. It's very less. So we are more focused on the ERT. So in ERT, a commissioning couple will be between 21 and 50 for the woman and 21 and 55 for the men. So there is a slight amount of difference they have kept in the age of the wife and the man who can have a surrogacy. But a single woman also can. It's called the intending woman. A single woman also has been given the right to have a child in our new law. Also, a single
Okay.
woman can have
Okay.
a child by IVF or
Right.
infertility,
Right.
or a commissioning couple, which is a man and a woman, married man and a woman. So these are the two entities. But the man has not been given the
Yeah.
right.
So
So
if
the
there's a
man can have it.
homosexual, yeah, if
So
there's a
man can have
homosexual
it.
couple, or there's a man who's undergone a sex change operation and become a trans girl, what about them?
No, so that suppose someone has become a sex change operator, and if she is defined as a woman, then she can have it. Suppose she has undergone a change operation and become a woman, and she has her own uterus and egg, she can have it. As far as the surrogacy is concerned, again, a couple can have it or a woman, divorced or widowed, but they have not mentioned about single women. So, please
Hmm.
understand there are two parts, ERT, IVF. Egg निकाला, sperm लिया, बच्चा बना के गर्भाशय में डाला, खुद के गर्भाशय में, उसको
Hmm.
हम IVF बोलते हैं, ERT बोलते हैं.
Yeah.
Who can do it? A married couple can do it, or a single woman, irrespective of whether she's single or divorced or widowed, she can do it.
Yeah.
Now, as far as the surrogacy is concerned, अंडा
Yeah.
निकाला, sperm लिया, बच्चा
Yeah.
बना के
It's yours.
दूसरे गर्भाशय में डाला, डोनर वूम में डाला. That who can do it? A married couple and also a woman. But in the new modification, there is a widow or a divorcee. But I have not seen a single woman. I'm a bit confused on that area, whether a single woman can do surrogacy or not. But provided there is a medical indication. So in the
Right.
forget a man. So our community, whatever. Now you may say that this is wrong, blah blah. That is a different story. I am just telling you the interpretation of law.
Yeah.
Both the houses, Lok Sabha, Rajya Sabha, Parliament, they have passed it. If they wanted to put the man, single man, they would have done it. They have not done it
Yeah.
for whatever their reason. So, okay, what is the, you will say, why the difference? Because they, as I told you again, the whole story is that a man is not complete. A woman is complete in herself. Please
Yeah.
understand.
Yeah.
Woman can be everything that a man can be, plus she can also bear the child. So, whatever, plus there's a lot of, let's say, ethical, social, religious, whatever. I don't want to go into. I'm a technocrat. I'm a scientist. Whatever the government says now, we should do it.
Yeah.
Now, remember, our country is a very evolving country. It's a dynamic country. So the Abortion Act, MTP Act, didn't they increase it from 20 weeks to 24 weeks? There
Yeah.
were a lot
Yeah.
of instances where there were malformation, there were rape. So
Yeah.
the House modified the MTP Act.
Yeah. Yes.
So once we implement these two acts, After 2 years, 3 years, we can all sit together again. We can find out what we can do. If
Yeah.
by the time the society gets more mature, you
Yeah.
okay, the Supreme Court starts giving more judgments about whatever, whether the LB whatever LGBT community can have children. That so
Yeah.
slowly evolving. We have made a start, a beginning. So let us
Yeah.
join hands, all of us, the
Yeah.
government, the doctors, the patient, the civil society, the NGOs. Let's join together. India is a what is the advantage of India? The West is our example, and the West took 400 years to evolve. In
Hmm.
England, do you know one hospital is there in England which is 900 years old? That old the civilization is there in the West. Ours is a baby civilization. Yes, we have a 5,000 years civilization, but let's say we have a 73-year-old young child.
Yeah.
We can derive the information and the experience of these our older parents, or let's say our older siblings, democratic siblings like Britain, which is 800, 900, God knows, 1200 years old democracy, and United States, which is a 400-year-old democracy, and derive from them and then implement it in our community in a very rapid way. And we can evolve our thing. I remember the other day I was listening to our great Amitabh Kant, who is the chairman of the Niti Aayog, and he was saying that there was a drone policy where they had 74 rules. And all the drone manufacturers went to the government and said, we can't do a business here with 74 rules. So the government reduced it by 70 rules. So
Okay.
our government is a very evolving government. They
Yeah.
listen to us and they
Yes.
will change. So if
Yeah.
there are certain aspects of these rules and regulations of surrogacy
Hmm.
and ERT which are not good, we will evolve, will
Evolve it.
change them.
Yes.
It is up
Yes.
to us.
Yes. So, what about international couples? If a non-Indian couple decides to come to India and with those medical condition wants to get a surrogacy done in India from a surrogate mother, would non-Indian couples be allowed to do that after coming to India?
No, only the OCI
Yeah.
can and the PIO can. So the Indian couple, both husband and wife, have to have an Indian passport, or if there's a OCI with
Yeah.
overseas, I mean
Dual
OCI card or
citizenship.
PI
Yeah.
card,
Yeah.
may be allowed to do the this thing. But so there is always what is known as a filter, and that
Yeah.
filter is the committee, which is made up of the civil surgeon, the obstetrician, and the pediatrician. The committee will decide whether this couple is eligible or not. Once that is done, they'll apply to the magistrate. The magistrate will go through all the papers and decide whether eligibility is not there or not, and then he will issue the certificate. Based on that, only surrogacy can be done.
Right.
The
And
surrogate will be altruistic, no money to be given, maybe
right.
little compensation which the
Right.
government decides in its
Yeah.
wisdom.
Yeah.
If she has to be married with one child, but I think they have removed there are certain new modifications in the act,
Yeah.
and
Yeah.
that surrogate can bear the child. Unrelated or related has not been put in the surrogate. As far as the egg donor is concerned, the
Yeah.
donor has to be unrelated. But at the same time, donor cannot be given money. So there are a lot
Yeah.
of
Yeah.
slightly
Yeah.
contradictory kind of things, but will work on it.
So then whose responsibility does it become to arrange an egg donor or to arrange a surrogate mother? Is it the main couple who brings their own surrogate mother along with them, or is it the IVF center who can arrange for them?
So no, so basically the IVF, they have said that there will be two entities. One will be the IVF clinic, and one will be the IVF or the ERT bank. So the ERT bank will be responsible for recruiting the donor,
Okay.
which who
Okay.
cannot be paid, please note.
Yeah.
So has to be,
Yeah.
they have to recruit the donor, they have to do all the tests and all that. And the X, where the X will be taken on, it's still very diffuse in the law. That will come in the rules. But
Yeah.
most probably the egg will have to be taken out in the IVF clinic, or maybe they'll say no, the ERT bank has to take out the eggs as well, freeze them, and then they can be given to the IVF clinic. So that's as far as
Oh.
the egg donation is concerned. As far as the surrogacy is concerned, again
Yeah.
the ERT banks will have to recruit the surrogate, and of course the surrogate can't be paid money, mild compensation that the government will decide per month what food can be given to them, what are the if suppose she says that I want to stay at home, and then also insurance covers have to be given for them. So but please understand
Hmm.
that both the so surrogacy act, as I told you, is one in thousand indication.
Hmm.
So if there are 1,000 patients who are not becoming pregnant, 999 don't need surrogacy. So the act is very chotu, and many
So
of
there's
us,
not going to be much of an impact.
yeah, yeah. So many of us may not even apply because there are too many fines, imprisonment. We don't want the headache.
Yeah,
It's a
yeah.
very so what is going to happen with that act? Probably none of us will even do go there. We are
Examine
doctors.
surrogacy. Yeah,
Who is going to bother with what is
yeah,
happening in the act? So we are just going to neglect that act. I don't think many people will even do surrogacy. Nearly
yeah.
you will forget it. So as far as the ERT Act is concerned, again, egg donation is about 5 to 10% of our work. 90% of our work is self egg and self sperm. No one wants to have a donor egg and a donor sperm. No one.
Yeah,
It's a pain.
absolutely.
It's an emotional trauma for the woman. She is reluctantly opting out for it, and within 7 years this will be over because what is happening, there's a new technology that has come which is now in Japan and China, which is in the mice at present. So you can take your skin cell and
Yeah.
you can convert your skin cell into an egg or a sperm. So already this has been done, and mice children called pups have been born. So within the next 10 years
Wow.
we will be able to make eggs out of the skin cells. So in next 10 years, donor egg is and donor sperm is
There'll be
out.
no requirement only, yeah.
Within next
Only
10 years,
skin
we have
cells.
forget. After
Yeah,
20 years, when our new generation comes in, they'll
yeah.
say, "Oh, what was that? Was it were they doing donor egg and donor sperm? Oh,
That will
what a
become
big
old
idea."
theory. Yeah.
So
Yes.
understand. So this
Yes.
the biotechnology. See, our science is going into three areas.
Yeah.
One is the space. Within the next 50 years we'll go to Mars and all. Maybe
Yeah.
our dump all our carbon dumping waste will dump in Mars. Okay, so that's the space. Second
Yeah.
voyage is going into the atom. We are
Yeah.
going deeper and deeper into atom. We are
Right.
getting into fission now fusion. Energy
Yeah.
generation will be through the fusion atom.
Yes.
So atomic exploration, and third
Yes.
exploration is in the cell. We are going back into the
Deeper
cell,
into the cell.
deeper and deeper, converting stem cells into organs, doing
Yeah.
3D printing, creating more organs, all
Yeah.
that. There's a new technology where you can pick up the cancer before the cancer is clinically manifested. 30 cancers can be picked up, just recently launched.
Wow.
So this technology, so our longevities will start increasing. There's a
Right.
the author Moses, Yuval Moses, who has you all know Moses has said that many of us will be live to the age of 170, and many women may get married at the age of 75 again because they will live till 150 years. So there are a lot of changes coming in the human.
Wow.
Even look, you
Wow.
will say pessimists will say, "Oh, what about COVID and all? What about COVID? How many people COVID killed?" We came to know everything about COVID. What is the virus? What is its
Yeah.
genetic code? How to evade it? How to treat it? Look at the intelligence of the human race.
Yes. Yes.
So this intelligent race is not going to listen to anyone. It will now start migrating to other planets also.
Right. Right. Very well said. So that was the lovely discussion with you on the recent laws on ART and surrogacy, and we are hoping that it's going to make easier for couples who can't conceive and who genuinely have medical issues. We are just hoping that every couple who wants to conceive and wants to have a baby should be able to do that. And like you mentioned that if there's any changes that would be required with time, hopefully government would evolve and change the laws accordingly, making it easy and simple for people. End of the day, we don't want people's health and body to suffer. And I'm sure that whatever changes have been made till now must have been for some big reasons that the government must have seen. So hoping that more women would, take care of their health and would hopefully focus a lot on their lifestyle, focus a lot on their well-being, and ensure that they follow a healthy life, a healthy lifestyle, and try to naturally prepare themselves for conception and a healthy pregnancy ahead.
Yeah,
So,
and one
sir, yeah,
thing
any
I want
takeaway
to
message?
tell everyone that you have to do everything in a parallel. Life has
Yes,
to be parallel.
yes,
I don't think you should wait. You should have children earlier. And I know it is a problem. It can be bad for a woman's career, but you must run your life in parallel. Don't run it in series. Our parents did it, and I feel earlier you get to have kids, get married earlier, have kids earlier, and in the wisdom, our fathers have given a woman that advantage. They have said, okay, if you are not yet married now and you want to have a kid, you can have it because they understand you better. I'm very proud of being an Indian. Our society is very enhanced, and they understand the position of a woman, how important that position is in society. I'm so happy to be the president of the Federation of Gynec Societies of India, because we gynecologists, we are the, I would say, the custodian and the caretakers of your health, your women's health. And so we have a fantastic position. Thank you.
So it was a pleasure listening to you, and we know that you have a beautiful journey ahead in 2022, and we wish you all the best. And we are hoping that lots of new good things would be created under your leadership during the tenure of 2022. So, sir, all the best, and um,
Yeah,
uh,
and in the civil society, people like we must join hands to
yes,
serve the women of our country. Remember that we have 500 million women, and many of them, nearly 80% of them, nearly 400 million of them are underprivileged. It is our responsibility, the remaining 100 million. It is our responsibility to care of the remaining 400 million. And
yes,
for that, we need us to do sacrifice. It is not easy, but the sacrifice is very important.
yes, yes, sir, absolutely.
Thank you.
So, sir, thank you so much for joining me on this show. It was a pleasure listening to you. Thank you so much for sparing out time.
Thank you. Thank you, Martha. It's always a
Thank you.
pleasure to talk to you and learn from you as well. Thank you.
Thank you so much, sir. Thank you.
Thank you.
Have a great
Bye.
day, sir.
Bye.
Bye.